Welcome to our channel. Today, we're diving into the findings from the KDAD study, which investigated the effectiveness of atypical antipsychotics in patients with Alzheimer's disease experiencing psychosis, aggression, or agitation. Alzheimer's disease is a progressive neurodegenerative disorder that affects millions worldwide, leading to cognitive decline and behavioral disturbances. Understanding the impact of antipsychotics on these symptoms is crucial for improving patient care and outcomes. Let's explore what the KDAD study reveals about these medications. In patients with Alzheimer's disease and symptoms like psychosis, aggression, or agitation, the atypical antipsychotics olanzapine, quetiapine, and risperidone did not show improved outcomes compared to placebo. This finding challenges the common practice of prescribing these medications for behavioral symptoms in Alzheimer's patients, highlighting the need for alternative treatment approaches. The study's results underscore the importance of evaluating the efficacy and safety of these drugs in this vulnerable population. Most Alzheimer's patients will develop challenging behaviors, historically treated with antipsychotic agents despite limited data. Rising concerns about increased cerebrovascular events and mortality led to this study. The KDAD trial was a prospective, randomized, double-blind, placebo-controlled trial to evaluate these drugs' effectiveness. This rigorous study design aimed to provide robust evidence on the benefits and risks of antipsychotics in managing behavioral symptoms in Alzheimer's disease, addressing a critical gap in clinical knowledge. KDAD enrolled 421 patients with Alzheimer's disease and randomized them to receive olanzapine, quetiapine, risperidone, or placebo. Dosages were adjusted for desired effects, and responders continued treatment for up to 36 weeks. The primary outcome was time until discontinuation of treatment for any reason, while the main secondary outcome was improvement on the Clinical Global Impression of Change (CGIC) scale at week 12. This comprehensive approach ensured a thorough assessment of the medication's impact on patient outcomes. At the end of the study, there were no significant differences in time to discontinuation between the groups. Median times ranged from 5.3 to 8.1 weeks. Olanzapine and risperidone had higher rates of extrapyramidal symptoms compared to quetiapine and placebo. These findings suggest that the benefits of these antipsychotics may be limited, and their use should be carefully considered, especially given the potential for adverse effects. There were no significant differences in cerebrovascular events or deaths between groups, but event rates were low. Extrapyramidal symptoms were more common with olanzapine and risperidone. Sedation was a notable side effect in all antipsychotic groups, significantly higher than placebo. These adverse events highlight the need for caution when prescribing these medications to Alzheimer's patients, as the risks may outweigh the benefits in many cases. KDAD contributes to the understanding that antipsychotics offer limited efficacy with significant toxicity in treating dementia-related psychosis and agitation. This aligns with previous studies, including a 2006 Cochrane review and the FDA's 2005 Public Health Advisory, highlighting increased mortality risks with these drugs in dementia patients. These findings emphasize the importance of exploring alternative treatments and non-pharmacological interventions for managing behavioral symptoms in Alzheimer's disease. The American Psychiatric Association guidelines caution against the routine use of antipsychotics for behavioral symptoms in dementia due to adverse events. The DARDAD trial also showed that these agents could be safely discontinued without adverse effects. Efforts to limit antipsychotic use have led to a modest decline in their prescription for dementia-related psychosis. Clinicians are encouraged to consider non-pharmacological approaches and to weigh the risks and benefits carefully when prescribing these medications. In summary, while antipsychotics like olanzapine, quetiapine, and risperidone are commonly used, their benefits in Alzheimer's patients with psychosis, aggression, or agitation are limited, and they pose significant risks. Clinicians must weigh these factors carefully when considering treatment options. The findings from the CATIAD study highlight the need for continued research and the development of safer, more effective treatments for behavioral symptoms in Alzheimer's disease. Thank you for watching. Don't forget to like, comment, and subscribe for more insights into Alzheimer's disease and psychiatric treatment advancements.